There is some bad news.
Okay.
You owe us several glasses
I
of
know.
wine.
I know. I was like,
Yes. But
it's
we're
like
promising.
5 bottles by now.
It's only bad news for you. It's good for us.
I'm leaving after my next talk, so you guys are screwed.
No, this stays
Sorry.
forever. It's
Yes.
anytime when
We have
see you,
evidence.
it's like, okay.
Okay.
Yeah.
And then the only thing I have to say is that, which we didn't say, is if you use the D word as in comparison.
Okay.
That's
We'll give
okay.
you. We'll give you a.
So I got some back.
Yeah.
So those
Okay.
won't
Yeah.
count.
We'll
It's
give
the
you some
ones
credit.
where you just say
talk
the
about
D
the D.
word without any relationship.
Okay.
That's when we get
Okay.
worried. So
Got
in
it.
the podcast.
I got
so
it.
thank you so much. This has
Thanks
been
so
wonderful.
much,
for having me.
That
Katie.
is wonderful.
The amazing
So
Dr. Tolbert. Thank you.
Excellent.
Sorry for Saying Sorry Media presents the Purr Podcast, the best podcast for feline medicine and surgery with tips, tricks, and updates for the entire veterinary healthcare team. If you're dying to know more about cats, keep on listening. Here are your hosts, Dr. Susan Little, famous cat vet and textbook author, and Dr. Yola Kerpenstein, talented surgeon and social media geek.
Hi, I'm Dr. Susan Little, and I am with.
Dr. Yola Kerpenstein.
And where are we, Yola?
We are still in beautiful New York
Yeah,
City.
I know. So we're time traveling.
Oyster City.
Yeah, Oyster City. Yeah, and
we
so
love
there's a bunch of things we love about New York, right? So we like oysters.
And oysters.
Yeah, and what else do we like?
Oysters.
Yeah, but we also like New York Vet. Yeah.
We like New York. I love the Metropolitan Opera.
Ah,
here.
that's true.
It's awesome.
Yeah. And
I-
Broadway.
And I love Broadway, and
Yeah.
I love the Metropolitan Museum.
Yeah.
Okay,
too,
there you go.
And Central Park.
We could do a whole podcast about
I know we
New
could.
York.
Okay.
Yeah.
But we have a wonderful guest here.
We do. We have Dr. Katie Tolbert, who's also speaking here at New York Vet, and we've already recorded part of a podcast.
This is number 2.
Yeah, this is part 2 with Dr. Tolbert, talking about the recently released ACVIM consensus guidelines on gastric acid suppressants in dogs and cats.
And we love consensus guidelines, so
Yeah, we
so
do.
let's go for it.
Okay.
So going back to the article, there
Yeah.
are big buckets of drugs.
Yes.
Can you talk about the big buckets of drugs and what their indication is
Yeah.
in cats?
The
So
big,
we
like the
talked-
classes.
Yeah, so we
Yeah.
talked about the sucralfate
Yeah.
already.
Yes.
Let's check.
Okay.
What are the other ones?
So there's misoprostol that we talk about, which we're not even sure. Again, insect-induced ulceration in the cat is very uncommon. And in people, at least, and again, I'm not trying to equate a person to a cat, but the only studies that we have, in people, actually, proton pump inhibitors, monotherapy, are superior to misoprostol alone. And so
And what class of drug is misoprostol?
misoprostol is a prostaglandin E1 analog.
Okay.
Yes.
So anti-inflammatory.
It sort of stimulates blood flow and bicarbonate secretion, so it's just kind of like a mucoprotective drug, essentially.
Okay.
And so I can't really think of a time or place that I would use misoprostol
In
in
a
a
cat. Yeah.
Okay. Off the list
off
it
the
goes.
list.
Off the list.
There it goes.
Okay.
So we got rid of sucralfate except for the 2
Very
indications we
specific
had.
things.
Yeah.
Yeah.
We got rid of this one.
Yeah.
Yep.
What about PPIs?
So PPIs, again, if you have documented what you think is either gastric or basically kind of like pyloric small intestinal bleeding, because anything below the pylorus is really not going to be affected. And so that can be somewhat difficult, obviously, and challenging. I just had a question from an owner who was from a veterinarian at this conference who was like, well, I have a dog with parvo who's having, frank hematemesis, and I don't know if it needs a PPI or not. And I'm like, reasonable to go ahead and treat with a PPI in that case. What I don't want you to do is just reflexively give a PPI sort of for every condition. Dog has parvo, I'm going to give a PPI. Cat has FIP, I'm going to give a PPI.
Yeah.
Think about it. Is there evidence that you think could be upper GI ulceration or esophagitis or something like that that you think would benefit from a PPI? Then you have an indication.
And just going back to the basics again, a PPI does what exactly?
A proton pump inhibitor basically suppresses or helps to suppress gastric acid production. So it raises the gastric pH. And the idea, again, is because we know that acidity can be very injurious to the stomach when you've already have an ulcer or an erosion. And so the idea is that you're trying to take away some of that injury that's ongoing now as a result of the acid that's there.
Okay, and so the other class, or at least another class, are the H2 blockers.
Yes.
Yep.
Which, to be quite frank, I can't think of a good reason to use in a cat because
Ooh.
Off the list it goes.
Wow, but this is really a paradigm shift,
Yes,
I think.
at least now. So let me give the caveat that all of our studies, pretty much with the exception of chronic kidney disease, have been performed in healthy dogs and cats.
Yeah.
And when we look at those studies, what we find is that famotidine, at least in the healthy cat, is a very, very weak acid suppressant, especially when given for more than a couple of days. So I can't think of a reason why I would give famotidine, because if I can only give it for a couple of days,
What's the point?
what's the point? And what am I treating?
Yep.
Do you know what I
Yep,
mean?
yep.
Now, the exception to that rule, and again, this is because I just think we need more studies, is some people report bilious vomiting in cats and dogs, and they say that Pepcid works. And maybe it does. We don't have the studies to say whether or not it does. It's a weak acid suppressant, but maybe when you have bilious vomiting, you don't need potent acid suppression.
Yep.
And so that's why I have to be a little bit careful about what
Yep.
I say. But I just think, again, we have such a problem with the misuse of this class of drugs that more than anything, we just need to try to take it off the list for the majority of causes.
So my understanding is that if you feel you do have an indication to suppress gastric acid in the cat, you're going to pick a proton pump inhibitor.
Correct.
You're not going to pick an H2 blocker,
Correct.
right? Yeah,
Yes.
you're going to pick an omeprazole.
Correct.
And we have some data, some PK/PD data, I
Yep.
think now on
Yep.
omeprazole in
Yep.
cats.
Yep.
Dose, what would you recommend?
If you're treating for ulcerative disease
Yeah.
right now, you really need to give 1 mg per kg twice a day, unfortunately,
Yeah.
and that sucks in
Yep.
cats.
Yep.
We just submitted for a grant through the Win Feline Foundation.
Yay, Win!
Fingers crossed.
I used to work with Win, big fan of Win.
So hopefully they're listening.
Yep.
Where we want to study some other acid suppressants to find out, are they effective? Like, for example, maybe, I talked about esomeprazole in this presentation that I just gave. Esomeprazole seems to be a very potent acid suppressant in the dog. There could be some evidence that you could use it once daily in the dog. If you could use an acid suppressant once daily in the cat,
That would be awesome.
how
Yeah.
transformative would that
Yeah.
be? And so
Yeah.
hopefully they'll be excited about that.
But
study
if there's
and
one
figure it out.
lesson we know is that it's really difficult to extrapolate from other species. to
Totally.
cats.
So we have to do it.
They
we
will
have
prove
to do
you
these
wrong.
studies. There's so many differences. Like, for example, just the bacteria that are in the duodenum alone, which is so important for sort of pharmacogenomics. Do you know? I mean, like, just like the way the metabolism of drugs, so many important things happen in the proximal small intestine. So just the fact that there are wide differences in the bacteria in cats versus dogs, the length is different in cats versus dogs. The way that they metabolize drugs is different in cats versus dogs. And so I totally agree. You cannot just say, well, because it works in dogs, it's going to work in the cat.
It's dangerous.
Yes.
Yep.
And that's like, the dexlansoprazole thing we just did, where we find it's probably not a good drug to be using in the cat.
There you go.
Yeah.
So the other thing that we should talk about, we haven't really touched on much yet, and we probably don't have much data in cats, but there can be some adverse effects from using these drugs. And it's getting certainly the PPI, chronic use of PPIs is getting some interest in human medicine,
Yes,
right?
absolutely.
Yeah. Now I know we don't know much in cats, but what are the possible things we should be concerned about? Chronically
so
using
the
them?
thing that I really worry, so a couple of things, I think. I mean, the one that I worry about sort of just on the short-term basis in dogs and cats, especially ones that are critically ill and hospitalized, is that it can have a profound effect on, the gastric pH. It raises the gastric pH. And gastric pH is a very important thing. Acidity is important for preventing bacterial colonization in the stomach.
Yeah.
And so, one of the things that can happen, at least in humans, is that even with short-term administration, you massively suppress gastric acid. Very quickly, you can have bacterial colonization in the stomach. They vomit and aspirate. You can have a really nasty
That is
bacterial
unpleasant.
aspiration
Wow.
pneumonia. And so that's one of the things that I worry about with dogs and cats on the short term. On the long term, we're not sure. Like, we did one study, 60 days worth of omeprazole in the cat, and it is a potent gastric acid suppressant. If you take them off the drug very quickly, you do sort of an abrupt withdrawal. They have rebound gastric acid hypersecretion. So you really need to taper the drug. What I would love to do, because people use Prilosec a lot in cats with IBD,
Yeah.
I would love to study cats with inflammatory bowel disease who are getting Prilosec, because I think that is a population that could be susceptible to some of the adverse effects that have at least been reported or associated with PPI use in people. Like, for example, could it cause vitamin B12 deficiency with chronic use? we know that cats with IBD and cats with chronic kidney disease.
They get B12 deficient anyway.
Yep. And then, could it, these cats are older, generally speaking. We know that they can get osteopenia. And so does PPI worsen that? Does it worsen sort of like, the hyperparathyroidism that they get as a result of their chronic kidney disease, et cetera? So I think there are a variety of things that we still need to understand, and we don't know because we haven't done those studies in these naturally occurring models.
And it's not benign to say, there's no evidence that it's harmful. That's not a good approach to take.
There's no evidence at all in veterinary medicine.
Yeah,
do you know what I mean?
I know. Yeah, and first do no harm, right?
Right. Exactly.
Yeah.
We don't have any evidence to do much of what we do, so I don't think that's a good way to.
No, and these drugs I think seem benign to people.
Yes.
They're common.
Yeah, they
don't
do.
They seem benign, but they're not necessarily so benign.
Well, in people, there was a decent study, like a pretty large study of like 15,000 people or something, that showed that it potentially is associated with acute kidney injury in people. That still needs to be worked out as well. But so that's another thing. Like, could it worsen chronic kidney disease in cats?
Could you get an acute on chronic?
Yes, exactly. So, all sorts of things that we need to understand.
And that's a pretty common disease in cats. So
yeah.
now we're treating something that's very uncommon.
Right.
And might be influencing something that's really common. So what about mast cell tumors in cats?
So with mast cell tumors, again, we have no data, but that's the one situation where I would definitely get the cat on a long-term PPI because I think the consequences of GI ulceration secondary to mast cell tumor are really severe. A PPI might be beneficial. I think there's enough indication that that's the one condition where I prophylactically will actually give a PPI in cats.
Unless it's a mass that Yola can take off.
Unless you can take it, that's right.
Yeah, but
right?
Even then, I think that what I always say is, you can take out the mass that you can see,
right,
but you don't take out the masses that you can't see.
Totally.
So I would even, I'm probably not allowed to say that, but I probably would even use it prophylactically, even if I take the mass out.
But it's an interesting question, isn't it? Because we don't know the answer to that, right?
Yeah.
But I think that's a situation where I know we don't have evidence, but you might want to fall on that side, right? And say because the consequences of the mast cell disease may be worse.
Exactly. Yep.
Than what we don't know about, using.
And a lot of the mast cell disease things that we know are also extrapolated from
Very
the
true.
D word. So. So because it doesn't happen that often, and there's very few real good studies
and it looks
in cats.
different in cats too.
And it does look different in cats.
Absolutely.
So and then there's a breed variation, which is really interesting. So there's lots of reasons why, but you don't want to take the risk in a way.
Yeah.
So,
no, I totally get that. There are cases where we just have to use best judgment, right? Yeah. But what I like about finally getting consensus statements like this one, at least we now have a little better idea of where those territories are, right?
Exactly.
Where the territories that say, really, you can stop using them.
Right.
Others that say, yes, you should use them, and then others that say, maybe you should think about using them.
Exactly.
Right?
And just going back to the mast cell tumor, because of that, you also need to send them in and see what type of mast cell it is. So the lower grades, I probably won't have that much
much
with it.
I totally
the
agree.
higher
if you
grades, they
have
will.
good surgical excision, low grade, we're not going to worry about it.
Absolutely.
Yeah, but again, it's not so common in the cat, right, to come across these situations.
Right.
But that's where some guidance like this is really helpful.
Yeah.
Yep.
This episode is made possible by the generous sponsorship of the Take the Pledge Against Strue Bites in Pets Facebook page. Did you know there are 3 easy steps to treat bladder stones in cats with lower urinary tract signs? Step 1 is to take a radiograph, and if there is a stone present in the bladder, step 2 is to use the Minnesota Urolift app for iPhone and Android to determine the most likely type of stone. Step 3 is to treat the cat for at least 2 to 3 weeks with an appropriate diet and see if the stone gets smaller. If so, keep feeding that diet until the stone is completely gone on follow-up radiographs. If not, check compliance with the owner and look for alternative treatment options. Join veterinarians worldwide to take the pledge not to remove struvite bite stones by surgery anymore.
So the other thing that comes to my mind as we're talking about gastric acid suppression is treating Helicobacter. Yeah. So in humans, right, I assume it's still the same, but they tend to use multimodal therapy for that, right?
Yes.
So it's a controversial diagnosis in our small animal species, and how much data do we have? So again, let's focus on cats. Let's say we diagnose and we decide to treat it, does gastric acid suppressant play a role in that?
So, I mean, I think based on what we know in people, which is Helicobacter pylori, which dogs and cats don't really get, Helicobacter is really interesting because it can do two things, which are polar opposites of one another. It can increase gastric acid secretion, and then it can actually cause gastric gland atrophy, where they actually don't have a lot of gastric acid secretion. So there's that. Like, there's a wide difference in the two. And so when you have the Helicobacter pylori that increases gastric acid secretion, yes, absolutely. Like, PPI is the way that you go along with, you know, the other drugs that they use, amoxicillin or whatever. For dogs and cats, it's a very difficult. It's kind of like how I feel like about Giardia a little bit. Like, not as it's more of an extreme example than Giardia, because I think there are times where Giardia seems reasonable as a pathogen, but
but not always.
But not always. So it's like, you know, could it be the case where, you know, like it's like IBD, where you have the right genetics and you have the right environment, and then you have, you know, all these things come to play where IBD develops. And so Helicobacter is one of those things where I think it's possible. Like, I think you could have a susceptible individual who has a, like, you know, diet or something like that increases its susceptibility, and then Helicobacter comes in and colonizes, and it causes a problem. Is that all of the story? Probably not. There's something else that's going on that you need to treat. But I'm not in the camp where I think Helicobacter never causes a problem. Like, I'm in the camp where I think it's possible, but I also think, like I think with Giardia, what else is going on? Do you know what I mean? What else do I need to find?
Yeah. I agree with you, because we, you know, certainly amongst all the cats that we biopsy, we occasionally get Helicobacter back on a biopsy, and I am not convinced at all.
Right.
You know, either histologically normal, they just happen to.
Exactly.
Right.
And so we see it a ton in our shelter, like our shelter animals and our colonies. We see Helicobacter a ton, and it doesn't cause inflammation.
Yeah.
You know?
So I think we're at the point where you don't want to, like, jump on that bus right away, right? You know, you've scoped or you've biopsied, let's say, a cat that has GI signs, and you get Helicobacter back. I mean, there was a time when we did. We went, oh wow, like, there's the answer.
Yes. It's just so rare. And you know, the thing that you don't want to do is just like treat based on anecdotal view of case reports information. Like, for example, Dave Tweed just presented a case that was like, I can't remember if it was a dog or a cat, but let's say it's a cat for the purposes of this podcast, that had acute gastroenteritis. They went and biopsied. They found Helicobacter. It had inflammation. They treated it with triple therapy for, I think, 4 weeks or something like that. The animal got better and never relapsed again.
Yeah.
So, you know, again, I don't want to practice based on, like, N of 1 case reports, but I also don't want to be that person that's like, it can never happen. Do you know what I mean? So I think that if you look for underlying disease, you don't find anything, that seems to be all you have. I think you treat it, and yes, I think you use a PPI to help
in that
treatment.
context. Yeah. It has been a little bit disappointing in that there's at least one, and maybe more than one study in the literature in cats that shows if you do treat the Helicobacter and you get clinical resolution, if you go back and re-biopsy those guys, it's back.
Yep, absolutely.
Right?
That's the thing.
It's
back.
Yeah,
exactly.
Is that okay? If there's no clinical signs, maybe it's okay.
Yeah.
It's very confusing to me.
For me, I feel like as long as it's not causing the animal problem or anybody else.
Yeah.
Like, it's kind of the case of, like, for example, you can have a dog that has roundworms that doesn't have any pathology associated with roundworms, but do you really want to leave a dog walking around with roundworms?
You know, with kids in the house.
Or other animals around or something like that. So Helicobacter, I'm sort of not as worried about, because I'm like, well, I mean, it's pretty much everywhere.
It's pretty much.
Do you know what I mean? So I'm not, like, that's the case where I'd say do no harm. It's not causing the cat harm. I could potentially cause more problems by giving drugs, and so I'm not going to do
and who wants to get triple therapy into a cat anyway?
Seriously.
Right. Yeah. Yep.
So.
And what does the triple therapy contain?
I think it's amoxicillin, and then bismuth, I want to say.
Yeah, bismuth.
And then omeprazole, and you can also add in, like, clarithromycin.
Some people add in like an erythromycin or a clarithromycin. Yes. So it's either triple or quadruple.
So just imagine getting all that.
Therapy, right? Yeah.
No.
And then
no,
multiple times a day.
Yeah, for multiple days.
Love it.
Yes.
Yeah.
Usually 4 to 6 weeks.
Yeah, and it's not like a week either, right?
Yeah.
And then it comes back anyway.
Yes.
Yeah.
Exactly.
So so you know, there just hasn't been as much talk about Helicobacter recently.
Yes.
We went through a phase when we talked about it a lot.
Yeah.
So I wonder, you know, how many people out there are still, like, seeing it and treating it. So it's kind of good to talk about it again.
Yeah.
Absolutely. Is there anything else from the consensus statement that comes to your mind for cats because we've talked about quite a few conditions where gastric acid suppressant may or may not be warranted. Did we miss anything?
I think we've kind of touched on it, but I just want to again make the case that, like we've talked about, cats are not dogs and cats are not humans. And so thinking about acid suppressant therapy or whatever it may be, don't use dog or human data to dictate what you do with the cat. So don't use drugs that haven't been tested in the cat. Like, they could be toxic. They could have no efficacy whatsoever. So that's the biggest thing that I think hopefully a lot of feline practitioners already sort of have.
Yeah, I think feline practitioners are a little bit more sensitized to it, but it's really worth stating, right? I mean, a drug that's bioavailable in the dog may not be in the cat. A drug that's not toxic in the dog, cats are completely different when it comes to
sensitivity. And vice versa, right? Like, we know that xylitol does not appear to be toxic in a cat, but it's very toxic in the dog. So
so it's really, it can be dangerous to make assumptions.
And it's interesting because this is the main reason why we do this podcast, because we found out there's so much literature about the other species. There's relatively few little literature about the cat itself, and so we like to speak with experts like you to kind of and of course a lot of the cat loving vets are listening, but there's also a lot of other people listening to the podcast and that might not have that much experience with cats in
I
general.
think that's why it's so important now that we have, and like full disclosure, I'm obviously, like, I have a lot of studies that are funded by the WIN Feline Foundation, but it is so nice to have a foundation that supports cat research, because you cannot get, like, the NIH, for example, to give you money to study things in cats. And historically, it has been a little bit more difficult. There's a smaller pot of money through the Morris Animal Foundation for cats. And so it's really nice to have foundations that are like, we just want to study cat diseases. We want to help cats. And so that's made my job a lot easier, because I'm like, well, I want to too, so let's do this.
And WIN is great. They've been doing it. So just, it's really good to give a little bit of a plug to WIN, because it's WIN, WINN, felinefoundation.org, I think.
Awesome.
WIN's been doing it since the 1980s.
It's amazing.
Do you know they were behind, they helped fund Paul Pion's research when he discovered that taurine deficiency
No, I didn't know that.
was one, or probably the major cause of dilated cardiomyopathy. So they're kind
and
of
that's coming back around full circle.
There you go.
Grain-free diets and all that.
So they're kind of a good, well-kept secret, in veterinary medicine. Many veterinarians don't know that some of these, like, pivotal studies or foundational studies or early stage studies of things we take for granted, funded by WIN.
Absolutely.
So full.
And
kudos.
so no, I totally agree with that. It's a wonderful organization. It's sometimes tough to get the cases. I remember that I'm looking at feline insulinoma a long time ago, and I had no cases. And so we're kind of revamping it right now. I think I've now 10 or 12 cases. But still, it's so tough.
Even with a more common disease, it can be hard to get case accrual for.
Well, that's the thing. When you get funding, it just basically kills your.
Doesn't it? I was just talking to this with somebody the other day.
Everything goes away once
the
you get
minute
funding.
a project gets in place, so I almost hate to see. Yes, I see a lot of cases of disease X, right? And then a project gets in place, and you won't see one for 3 years.
Exactly.
Yeah, so that's why we wanted to do the cat abscess study, because at least you see those.
Yeah, you're good. You're gonna get like 500 in a day.
We did a podcast with a surgeon.
Yeah.
Keeps you all happy,
Yes,
And anyway, one of the things we touched on was cat abscesses, and there's actually surprisingly little research about cat abscesses.
It's crazy.
That is surprising.
Yeah.
So we were talking about antibiotics and should we use it or should we not? And there's really no
there's actually no
research,
data.
Okay.
and everybody's using it. So
yes.
that's the whole
So
thing.
somebody's doing the study to figure out.
Well,
No, that was our suggestion.
Yeah.
So we want to get the cat world together, all the cat vets together, and at least submit like 1 or 2, which you get per week. So we're done in a week with accrual,
That would be the nice thing, is could we form like sort of like a web of
like a
private
network.
practices and institutions that
web.
want to do cat studies and like basically be like, all right, I have
because collaboration is a big thing.
And it's good to be represented. Like, different regions might see different things, and so I think that's helpful.
Totally. Yep.
Wonderful. Yeah, well, great interview. So thank you so much.
Awesome. Thanks for having me.
Wonderful.
Now there is some bad news.
Okay.
You owe us several glasses.
I know.
Of wine.
Yeah.
I was like,
Yes. But
it's like 5 bottles by now.
It's only bad news for you. It's good for us.
I'm leaving after my next talk, so you guys are screwed.
No, this stays forever. It's anytime
we have
see
evidence.
you, it's like okay.
Yeah.
And then the only thing I have to say is that, which we didn't say, is if you use the D word as in comparison.
Okay. We'll give you a.
So I got some back.
So those will won't count.
We'll
It's
give
the
you
ones
some
where you just say
talk
the
about
D
the D.
word without any relationship.
Okay.
That's when we get
Okay.
worried. So
Got
in
it.
the podcast.
I got it.
So thank you so much. It's
Thanks
been
so
wonderful.
much
for having me.
It is wonderful.
The amazing
So
Dr. Tolbert. Thank you.
excellent.
The opinions of this podcast are those by Dr. Susan Little and Dr. Yola Kerpenstein. Veterinary medicine is a complex profession, and often there are multiple diagnostic and therapeutic options for different disease processes. If you're a pet owner with questions, please go to your local veterinarian. If you're a veterinary professional, ask your questions on our Instagram page @PerPodcast. Dr. Susan Little is a feline medicine specialist with 2 cat-only hospitals in Ottawa, Canada. She is best known as an international speaker and as the author and editor of 2 textbooks, The Cat, Clinical Medicine and Management, and August, Consultations in Feline Internal Medicine. Along with 3 cats, she also admits to owning 2 dogs, and you can follow her on social media with the handle @CatVetSusan. Dr. Yola Kerpenstein is a diplomate of the American and European College of Veterinary Surgeons and a big cat fan. His specialties range from surgical oncology and reconstruction to minimally invasive surgery. He is the author of 2 textbooks on basic and reconstructive surgery. Did you know he was allergic to cats? Yola works currently at Hill's Pet Nutrition. You can follow him on social media with the handle @GVETSX.